Hey there, everyone. Welcome back to another episode of the Growth Rune podcast, where we dive into all facets of healthcare with experts who are leading the industry. Please join me in welcoming Mike Treash, the Chief Operating Officer at Health Alliance Plan. Thank you so much, and we appreciate you for joining us, Mike. Can you tell us about yourself and what you do at Health Alliance Plan?
Hey, Sal, thanks for inviting me on the podcast. Looking forward to the conversation. So I'm the Chief Operating Officer, so we pretty much are accountable for the gamut. We process claims, do enrollment billing, we answer phone calls, and I'm also responsible for technology. And that's why we're having the conversation today, is because I remember, Sal, when I took this job 7 years ago, somebody asked me, what's the one thing you're most concerned about? And I said that data thing, that business informatics, and now I probably spend 70% of my time talking about data.
Yeah, I would say data over the last 10 years has gotten more and more informative for us. There's been a lot more logging. There's a lot more tracking from after going from paperwork to digital and starting the whole digital transformation journey. But before we jump into that, what is your workflow like? What's it like to be Mike for a day? Before we jump into that, what is your workflow like? What is it like to be Mike for a day?
Yeah, it's interesting, Sal. We are a nonprofit health plan in Southeast Michigan in Detroit, and we have a very diverse customer base. And we are owned by a nonprofit healthcare system, Henry Ford Health, and Henry Ford Health owns hospitals, physician practices, outpatient pharmacies. They're invested in a durable medical equipment company. And so we're pretty grounded in the community. And the nice thing about a health plan this size is, I get to work with physicians, and you actually get to meet, customers or patients or members or consumers, whatever you want to call those folks. So from my perspective, a health plan this size, you kind of have to do everything. I deal with, interact with the board, and I interact with my peers, and I interact with frontline folks out there who are working with consumers every day. And it requires a lot of flexibility and a lot of range. 10 years ago in this space, you were talking about claims a lot, and you were talking about call center and talking about how you onboard a new group. Now I spend a lot of my time talking about data modeling, data infrastructure, talking about predictive analytics. And that's how this role has changed so much over the time. So my typical day, I just got off a call for CFO, and we were talking about predictive models, trying to be able to predict which members of our Medicare PPO are going to be profitable in the future versus those who aren't going to be profitable, and how we can act on those insights as we develop those models. So Sal, that's how I spend my time. And when I say 70% of my time is on data, it truly is. It's about how do we use our data to derive deeper insights in being able to predict our consumers' behavior and how we can actually interact with them in a positive way.
Let's talk about using this data. So, how critical is technology in your day-to-day processes? What processes, tools, or technology do you rely on to perform optimally?
It's funny, man. I hear people talk about the digital economy, and my reaction always is, you should stop watching reruns of Friends at night and get yourself out of the 1990s, because we're not in the digital economy anymore. We're in the data economy. And what I hear is, we got to invest in our digital front door. And I don't disagree with that. We all have to be omni-channel. We have to have call centers, and we have to be able to mail postcards. But we have to be able to send a mobile message or a text message or an email and support chat. We have to do all those things. But again, if that's where you're investing, and that's where your strategy centers on is that digital front door. I think you're gravitating towards the mean because we're all buying the same tools. We're buying the same CRM tools. Where I see value being created now, being created more in the future, in the digital front end tools, somewhat. And I'm kind of, demeaning that a little bit. It's definitely not in the back end. It's not in the claim system. It's not in those things that we, do to support enrollment and billing and claims processing and all those things. It's in our data infrastructure. So it's being able to have a data catalog so we understand, where are those terabytes of data that we have that we can go out and identify that data and retrieve it. And it's also having a master data management tool so that we're really efficient at governing our data and mastering our data and providing quality data in a time period which meets people's needs. So when you talk about technology, I spend more of my time talking data infrastructure, definitely talking CRM, but the CRM, a little different. I view a CRM is creating an opportunity for us to do different campaigns and messaging with consumers, which is cool for them because I'm not wasting their time. If I deny a claim, I now let them know ahead of time, hey, we denied your claim and this is what you got to do next. That's cool stuff. And that's market differentiator. I also see though those campaigns and interaction as an opportunity to provide our data models feedback so we can train those data models to make them even smarter. So that's where we spend our time. That's how I view technology right now. Some of our technology processing and claim, honest to God, it's a utility status. The digital front door is important, but maybe not ways other people think of it. It's really that data infrastructure from a technology standpoint, which is important to me. What we really need to talk about, though, is the data literacy. When I said that a digital front end tool is you're gravitating towards the mean, we make that investment. I think kind of like data infrastructure, the same thing. Data infrastructure, we need to have it. But if you're not a data literate company, I equate that to kind of buying a Ferrari and driving at 35 miles an hour on the freeway. You're over clubbing it. And so Sal, I think about this journey using data, and it is a transformation game. And when I look at, the people aspect of it versus the technology aspect, technology is easy. It's not that difficult if you understand it. The people parts is really hard.
So, what about the team you lead? What kind of challenges are they facing? What type of technical solutions, or if it's not a technical solution, maybe some technical level of learning of data literacy might need to happen? Do you feel like there needs to be some sort of change going on?
Yeah, it's a tough time to be in healthcare right now. We're all suffering from the post-COVID fog, and people have deferred their care, so they're getting, they're getting the knee replacements, they're getting the shoulder replacements, and unfortunately, they weren't getting access to things such as cancer screenings. So you're seeing this explosion of demand right now, and you're also seeing not enough providers out there to meet that demand. And so it is a tough time. This is one of the toughest times ever be in healthcare. A lot of health systems are living off the balance sheet right now. The tough thing is trying to craft what do you do about this, and how do you move forward when labor costs are high, supply costs are high, and the demographic impact of the baby boomers is really hitting us hard right now. It's kind of the perfect storm. It starts with us. Like, how do we transform? And Sal, I think I'm asking people right now to consider a new operating model. And the new operating model is let's use data to inform ourselves more about the business so we can make smarter decisions, quicker decisions. But at the same time, let's use data to inform ourselves more about our consumers. The more we understand about the consumer experience, the more we understand about these consumers, the better we are to equip them to make right decisions, the better equipped we are to wow them with our customer service. And frankly, when it comes to things such as generative AI, it's the same muscle memory that now we can automate document retrieval and content generation in very efficient ways that we, unless we had a good muscle memory around being able to do data modeling, generative AI would be very foreign to us, but it's not because we developed that muscle memory. So that's what I'm asking people to do. Frankly, when you talk about data infrastructure, I can simplify that. What I want folks to do is really, think about data models and how do you construct a data model and how do you use data modeling to monetize. And there's lots of ways we can do that. And that's the transformative piece about this. I'll worry about the data infrastructure with my IT team, the common business owner out there. I really want them to get thinking about data models and how to use predictive analytics. That's where I want them to wrap their head around. And that's, again, that's the transformative piece of this conversation.
Yeah, I mean, jumping into the whole AI realm of things. So I get to hear a lot of different perspectives out there. And currently, everybody acknowledges generally that AI has a big, massive role to play this year, but everybody's just kind of getting their feet wet with AI. Nobody's sure about how they should approach it and how they can properly utilize it. So, what are your thoughts around how some of this change should be deployed? So, what are your thoughts about how some of this change around AI and AI learning should be deployed throughout the workforce?
Yeah, it's funny. I rarely use AI. I just talk about advanced analytics. It keeps attorneys away from me, and it keeps the board, calm. And it really is advanced analytics. And we've done some things in, like I said, a lot of examples where we used, AI light tools and methodologies. We're using generative AI in our call center, and it was interesting. I mean, a lot of folks do the same thing. Is my call center reps takes them about 2 minutes and 10 seconds to be able to retrieve a benefit document or documents and read through those and be able to generate a response. We're using, just basic GPT right now, and we got it down to about 5 seconds. Absolutely remarkable. What's a game changer, and there's people are doing it right now, is kind of the flip side, because about 30% of the calls, we will use that tool. The flip side is I see folks out there actually, training models to do the documentation of a call. That's a game changer because it takes 3 minutes off of every call. I'll be honest, an organization our size, it's hard for us to scale to do that. So when it comes to large language models that we're going to use in the call center or use behind a RoboChat, we're going to be a buyer in that space. The thing that we did do, though, is we did enough to inform ourselves, so we're not going to be uninformed consumers. We went through the effort to stand up a call center, and the model we use, you can't train it. It's not really not a trainable model because it's ChatGPT. But what we did learn is we could change our source documentation to get better responses. We could develop desk level procedures, really prompting of our call reps so that they ask the right question to get a better response. Until we have an LM that a consumer can use on their own, because a consumer is not going to have desk level procedures out there to prompt the LM to get the right response. So we're a ways off. My challenge right now as being a small nonprofit is when you look at like an Aetna or a United Health Group, the outlier question they get, every 3 days, I get it every 3 months. So I don't have the scale to do that. We will definitely be a taker. We're using AI like natural language processing in other areas. We've been doing this for years, mining our call recordings and turning that into data. We've recently made an upgrade in some of our technology there, and we're suffering right now for having too much data. Too much. And that's the thing. When I think about investing in the infrastructure and investing in the capabilities, it's this fine tuning, man. We over club it. We got too much technology, and as an organization, our capabilities not caught up with it. Right now, using natural language processing to mine data in our call recordings, in our IBR interactions, and our web interactions. Yeah, we probably overclubbed it a little bit. We got to grow into that, which is fine. It wasn't a huge investment. And that's the thing, Sal, right now, as an executive, man, you gotta like this fine balance, little water balloon thing you got going on out there is if you over invest in your technology, you're under clubbing it. If you over invest in your data literacy, you got your people just screaming, I need data faster, quicker, better, which frankly, that's the piece I want. I want people other than our actuarial team saying, I need a better way to go out and grab data so I can have it quicker and I can have more data. When I start having other people other than the finance team and the actuarial team asking for that, I know this transformation is taking hold.
Yeah, it definitely seems like I speak with some of the IT teams at other healthcare organizations. And I asked them directly, what is it like on your end right now? And they are constantly getting requests from all the different types of departments that are there. I need this data. Can you pull this report up for me? Can you get that for me? And that's not including all of the maintenance and maybe the cybersecurity stuff that the IT staff already has to serve. So I agree with you. It is a big problem, extremely transformational. Because if you could eliminate a 30-minute data request or 1 hour request, data request, and turn it into something like 5 seconds, that would be huge.
So it'd be huge. I will say it starts with the business owner, business data, so start in IT. And I'm going to give you an example. I was working with somebody and they asked that we tackle a problem for them. And I had to come back to them and say, I can't do it. Can't do it. The reason is because all the data you want is sitting in an Excel spreadsheet on top of one of your employees' computers. Can't do it. If that data was in the data warehouse or in a data mart, it'd be a different conversation. And so how do you start that conversation? That's the bigger challenge than I think than technology. And I try to get business owners to think in layers, because IT folks, when they think about data, they think in layers. And whenever I articulate this to business owners, I know my IT folks, they kind of shake their heads like, it's not exactly right, but that's fine. I try to make it simple for the business owners. And I say, let's think about this conversation in layers. I'll tell you where you play and where you don't play. And especially in healthcare, this resonates. Its first layer is interoperability. And interoperability is our ability to exchange data with our business partners. It could be vendors, providers, employers, the government, you name it. And what's changing there is bilateral data exchange, meaning I'm just not exchanging a file with somebody. I'm exchanging data in near real time or near real time. And it's really smart because I can then ask for a medical file to come along with that. All right, I can push and pull a request in real time. So that's how that's changing. Above that, it's the data layer, and I call it the data democracy layer. And that's typically where the people think about, I want my data, quicker and better. And that's how we make data available, make it visible, make it reliable, good quality data. And we do all those things which aren't really sexy and fun, called data mastering and data governance, which nobody really understands and nobody want to talk about. It only matters when the data they can't rely upon, and then they realize that, no, we got to spend time to figure out which email address we use for Sal because we got 4 of them. And that's not easy. It's not easy. It's not sexy. You're not going to post up on LinkedIn about that we'd master some data. So that's like the second layer, that data democracy layer. And it involves architecture as well. I mean, there's a reason I don't want you banging against the data warehouse because there's terabytes of data out there. Let's just create a data mart for you, and you got a handful of data out there. It's way more efficient. And people, they can wrap their arms around that. The third layer, and this is kind of radical, and this is where I really tried to affect change, is I call it the model layer. being able to create a data model and scale that model. And that means having standard nomenclature on the models, having standard construction of the models, being able to reuse the models, being able to reuse the tables, being able to clearly articulate across the organization is a predictive model. Everybody knows what that means. And it's funny, man, there's like about, you look at Tableau or Power BI, there's probably, 20 plus visualization templates in there. I'm telling you, as an organization, if we can land on 2 to 4, that will cover 80% of our analytics, probably 90%. We recently had a poll. We had our community practice meeting this week of all of our data analysts. And we asked a question. How many of you have ever been trained on the standard operating practices or best practices for a line graph? 63% said they'd never been trained on that. And then we asked them, when it comes time to make a decision about a visualization, is it the business owner, is it you? And 64% said it was them. I'm like, so you're making the decisions and not even you are trained in the most basic visualization Power BI. So that's kind of like, that's the data model layer. Standardizing the data models, reusing the data models, reusing the visualizations. And then I talked about the data ecosystem. The data ecosystem, man, it's those kids in universities and data science programs right now, or if I can give them a data set and they can use it in that capstone project, and I'm accessing free labor. I'm also involved working with other health plans across the country, not sharing data, but sharing data models. Very different conversation. I'm involved here in Southeast Michigan with companies outside of healthcare. Same thing. How can we share data models that we can also then provide to our universities, our startups, so that we create this little ecosystem of data labs within Southeast Michigan will benefit all of us. So when I get business owners thinking about it in that context, that lowers the playing field. Now we can define and kind of frame the conversation for what's next. And man, I'll go back. It's that second piece. It's that talking about data models and talking about how you create an ecosystem. That's the hardest part. Interoperability and democratizing data, or that data infrastructure. And it's just investment in time. The hard part is the transformation.
Yeah, I mean, the interesting part is a lot of people working on the healthcare side, whether it be through, going down the nursing path or the physician path, or the, diagnostic, one of the other specialties, they don't really teach any of this stuff. What's going to happen to us then, Mike?
That's a scary question, because, we're in a meeting. Again, we had a meeting yesterday talking about our strategy, and I asked this several times. How many of you here in the room, this is our senior leaders, VPs and above, how many of you have data on your resume? And there's not a single hand up. Not a single hand, because these people elevated to these titles because they could manage people, they can manage the complexity of healthcare, they can manage workflows. Those are traditional skill sets. And it's funny, man, they kind of, I'm guilty as anyone, for most of my career, is you relegated data strategy to the BI team and the CIO. And I'm telling you right now, I'm not lying. 99% of what I learned about data, I learned in the last 3 years. And I've had, at our meeting yesterday, we had around our data strategy, I had somebody come up to me and said, there's a lot of technology out there. You can just go buy a platform. Healthcare accelerators will take our data and we'll plug and play a lot of visual analytics for us. And I've seen it. Good stuff, man. It's really cool. I mean, I'm not dismissing we might buy something like that in the future. The issue, Sal, is this. If we do that, we basically outsource our data literacy. Because we do that, people don't understand what it means to actually iterate on the data model. They don't appreciate what that means. That's the differentiator. We can source data. I can source SMEs. The differentiator for us is being able to construct a data model and to constantly iterate on that. And it's a tough conversation, because the change management, Sal, is simply this. If I implement a new telecom platform, there's a start man. If I invest in data literacy, there ain't no starting in. We're investing in new capability. And for people in the C-suite and who have gray hairs, you're gonna put your neck out into something which is poorly defined and evolving so fast. And it clearly, you're going to be, I remember this video a few years ago was some outdoor concert, and there was this guy who was out there dancing by himself, maybe, induced with some chemicals, I don't know. And then after a while, people started coming joining the dance. And after a while, you realize he wasn't so crazy. It was a movement. So if you're a C-suite leader right now, and you're saying we need to invest in data strategy and we need to invest in data literacy, you're kind of the crazy person out there, man, dancing to the side of the hill. And that's brave. Who wants to do that, right?
Yeah, I mean, for sure. There's definitely a bell curve here. There's definitely a bell curve. I've encountered some people that are just completely reluctant to it, and I'm like, well, it's coming. There's nothing you can do to stop them. But what are your top 3 technological improvements that you believe would have the most impact for you at Health Alliance Plan or healthcare in general in 2024?
Yeah, Sal, we're looking at a few things. So we have a CRM tool that we use. We've not used all the channels, so having more channel expansion, because I want to be able to do this. I want to be able to use our data and do cluster analysis to be able to use our data to influence consumer behavior. And it's funny, you see in this world, the marketing folks will talk about doing campaigns. And I saw this happen. They're talking about doing campaigns. We're going to use our CRM, we're going to do some campaigns. And they had the clinical folks. And clinical folks like, oh, we don't do campaigns, we do outreach. Like, okay, so what's outreach? Well, it's using data, and then we try to communicate to the patients to try to get them to take the hypertension medicine or test for diabetes or lose weight or stop drinking, stop smoking. Like, how's that not a campaign? It's interesting because when you talk about cluster analysis, and I spent a lot of time with people in the retail industry trying to understand what they've done and what their journey was like. And it applies in trying to get people to enroll in HAP, people to stay in HAP, trying to get folks to take hypertension medicine, trying to get people to get a wellness visit, try to get them to get a vaccination. It applies trying to get them to sign up for a digital EOB. We spend $6 million a year on paper and print. You know how many wellness visits for expecting moms that would cover? It applies so much across the board. We can scale doing cluster analysis and scale better ways to use our CRM tool. We can improve our HCC scores. We can improve our HEDIS scores. So when you ask about technology, I'm going to kind of go back and, back up a little bit. I poo-poo the digital front door a little bit. The value of a digital front door is being able to do both push and receive messages. Push to sound when I can find the right channel and the right campaign to use, because I think that has the highest probability to get him to do the right thing. One of the things we look at, go back to digital EOBs, one of the things we look at digital EOBs is like, okay, so what influences people actually sign up for digital EOB? And an EOB is the explanation of benefits. That's that awful document that looks like an IRS form that your insurance company sends to you, and the first thing you do is you throw it in the trash can. About 30%, 28% of our customer base is signed up for EOBs. And if I were to ask, okay, Sal, who do you think it would be, young people or old people? And you're going to say young people. And you're right. Age is like the number one variable that will predict who signs up for digital EOB. I got to be honest. Thank you, 24-year-olds who are perfectly healthy for signing up for digital EOBs. You don't do a damn thing for me trying to bring our pre-cost down because you don't have any healthcare. It's that person who's older, who's got a lot of stuff going on. And in Medicare, because of the regulations, that EOB might be 70 pages long. That's where our spend is. But it's more than age. It's fascinating. If you look at it, zip code is a good indicator of you're signed up for digital or not. In our market, Oakland County, which is the high affluent county outside of Detroit, and then Washington County, which is the home of Ann Arbor, University of Michigan. That's their two biggest adopters of digital. You can also break that down by zip code. Well, zip code is a de facto indicator of education and income. So people have higher incomes and higher educated, more likely to sign up for digital EOBs. It could be they're more comfortable. It could also mean they can afford the technology too. All right, dig deeper than that, and it's even more, because if you go downtown Detroit, even if you look at the high income zip codes in downtown Detroit, that still holds true. So this is where we're at now. It's like, okay, let's look at gender, and do we craft a message for high income women in the high income zip codes? And maybe we have one, which is the tree hugger campaign. Hey, save the trees. Stop making us print stuff out. Or we could have one that says, we could spend this money on wellness visits for low income moms rather than sending out doctors. Please help us do this. And that's calibrating. It's calibrating on the cluster. It's calibrating on the campaign. You also have to calibrate then on the channel. So your question was what technology? Well, it is that CRM. But the CRM, if it's the fire that make this conversation go, I'm telling you right now, man. So the data models, that is the oxygen that will feed the fire. That's one technology sell. The other is we're making investments in the back end. We're getting to the point now. It's just not my actual team saying, I need data quicker. It's now other people saying, I need my data quicker. One thing you learn, so I've been working with some of our data analysts. And it's funny, I was working with this guy who was new, full of energy, and we developed up a really good rapport. His challenge was he doesn't know where the data is, and because we don't have a good data catalog, it's very difficult for him to find the data. Started working with somebody who's been with us for 21 years. A little less open, a little less creative, but he knows where all the bodies are buried. So he knows where all the data is. He knows where some data models worked on 4 years ago that we can reuse. And I've gotten a lot faster working with him. The challenge is simply this: because we don't have a data catalog that makes it easy to see where our data is, and we don't have an MDM tool right now, which makes it easy to master that data. It takes effort. He relies on the same data. He relies on the same data sets over and over again. And I'm not criticizing him. I do the same thing. And that's the challenge. A data cataloging tool, which we're standing up, and an MDM tool is going to allow us to bring that newbie in and even help that person who's been here for 20 years to see everything and see the possibilities. And that's going to enrich this conversation. So when I think about investments now, those are the three things. It's continuing to expand our channels in that platform, and then maximizing that, and then being able to democratize that data.
Well, thanks for data modeling with us in real time here, Mike. What an adventure. My concluding thoughts are that AI has a big role to play in healthcare this year. Implementing AI really well will provide the most impact out of anything else. It was such a pleasure having you on the show, Mike. I'm looking forward to having you on for future episodes.
Sal, thank you. It's been a pleasure.